Hello, I'm Janet and I'm going to be talking to you about our VideoClinic study. So to date, some studies have evaluated video consultations in secondary care, but the numbers have been small and findings have differed. So our aim was to evaluate VideoClinics at the University Hospital Birmingham to assess whether they improved patient satisfaction compared to face-to-face consultations. We recruited clinically stable liver transplant patients who were 1 to 5 years post-transplant, and they were randomised to either intervention, which was VideoClinics, or usual care, which was face-to-face appointments. They were eligible if they could access the hospital's My Health portal, arrange for clinical tests to be carried out locally via a GP or a dialysis centre, and have access to a computer with a camera and internet access. So all participants completed a modified VSQ9 questionnaire at baseline and after each appointment for the following 12 months. A 10-point difference in scores between the groups at 12 months for 3 of the VSQ9 domains was considered to be significant. Those 3 domains were convenience of location, getting through to the office by phone, and length of time waiting. Data were analysed on an intention to treat basis. Interviews were undertaken with healthcare professionals and patients to assess and understand their experiences of using the VideoClinic software. So 54 patients were randomised, 29 to the intervention arm and 25 to usual care. 129 appointments were conducted over the study period, and we had a 64% return rate of questionnaires. The within-group analysis shows that patient satisfaction scores increased significantly for the 3 VSQ9 domains, both for the intervention and usual care groups. An ANCOVA analysis, after adjusting for baseline, showed that the between-group difference was not significant. The study was underpowered to reliably detect differences between groups and therefore may have found false positives. The crossover from the intervention to the usual care group was high, and the reasons for this were patient request, health reasons, and a missed virtual clinic appointment. The interviews revealed that in general patients liked the VideoClinics. They reported that they saved them time and money, they were less burdensome, and they had fewer negative effects on their health. However, a small number were wary about the confidentiality of the VideoClinics, and some said that they felt distanced from the consultation. Overall, both patients and healthcare professionals thought that the VideoClinics were positive, beneficial, and the way forward for routine hospital appointments. Both parties experienced problems with the software, for example, sound and visual problems, difficulty uploading test results, and computer incompatibility. However, as the study went on, patients and clinicians found workarounds to these problems. The technology is constantly evolving, so as time goes on, we're sure that these problems will ease. So this study has found that remote consultations were not carried out to the detriment of patient care, and many patients found that their video appointments were a positive experience. Although we have to remember that VideoClinics aren't for everyone, and a few prefer to be seen face-to-face. Before a wider rollout of VideoClinic appointments, we feel that some process issues need to be addressed, but it is likely that with the development of a smartphone app, many of the technical issues will be resolved. There also needs to be more planning around the processes to ensure that patients can obtain clinical tests locally and that those tests are available during the consultations. It's also important to consider equity of access to VideoClinics. For example, not everyone has access to technology, and there may be poor technological infrastructure for those patients living in rural areas. However, overall, we feel that patients must always be offered a choice of either a face-to-face or a video appointment. Thank you.